Good morning, everyone. Thank you so much for joining us this morning for a discussion on the COVID-19. We apologize for a short delay, but again, are so glad to have you all with us today for what I think will be a very, very interesting discussion. My name is Phil Diamond. I'm the spokesperson at the U.S. Embassy. I'm joined this morning with Dr. Lisa Nelson from the U.S. Centers for Disease Control and Prevention, or CDC. And the Honorable Minister, Dr. Jane Ruth Aceng from the Ministry of Health. Thank you so much for being with us today. And this discussion this morning will be about COVID-19 in Uganda, the response effort that is underway, ways that the U.S. government and the government of Uganda are working together to address this. It will feature opening remarks from both Dr. Nelson and Dr. Aceng. And then the focus of this event is really for your questions, all the viewers. We want you to be submitting questions. We've already received some, but take the time as the event is going on to type your questions directly into our Facebook page, and we will try to answer as many of them as possible. We may not be able to answer every single question, but we'll try to get through a lot. And afterwards, we will do our best to answer them online via the chat. This is an opportunity for you to ask anything that's on your mind related to COVID-19. It's an informal event. We want this to be a dialogue between all of you and us. So afterwards, this video will also remain up on the embassy's Facebook page, U.S. Embassy Kampala, for anyone who didn't get a chance to see the whole video today. So with that, thanks again for joining us, and I will pass the microphone to Dr. Lisa Nelson for some opening remarks.
Great. Thank you, Phil. Good morning. And thank you to Minister Aceng for taking time out of her very busy schedule to be here with our live audience this morning. The U.S. mission and the government of Uganda are here together this morning because we are in this fight together, and we have been for decades. When it comes to health, our relationship is built on a long-standing collaboration, one pillar of which is supporting Uganda's ability to detect and respond to disease outbreaks such as COVID-19. Together, we were prepared before COVID-19 arrived, and in partnership, we are responding quickly and to the best of our ability to control the spread. You might ask, what have we done to be prepared? What does that mean? When flights became restricted and borders began closing around the world, we did not have to figure out how to bring in lab equipment or experts to train laboratory technicians. They were ready and waiting to act as soon as the test kits became available. We did not have to scramble to set up an emergency operations center. It was already in place and managing 6 simultaneous outbreaks at the time that COVID-19 was announced. We did not have to train field epidemiologists. They were already trained and ready to respond immediately. We did not have to figure out how to collect and transport samples from the farthest reaches of the country because the lab sample transport network and lab hubs were already fully functional. Key people had already been trained in incident management systems, and Zoom, the video teleconferencing system, was already part of the national response capability. In addition, Uganda's response has been proactive, not reactive. Uganda acted early to institute self-quarantine with follow-up for high-risk travelers, and soon thereafter institutional quarantine as Uganda detected its first cases. Limitations on mass gatherings, strategic closures of schools and borders, and restriction of movement were likewise implemented early to ensure social distancing and to reduce the risk of COVID-19 spread. To date, Uganda has had 53 cases and 0 deaths. There is emerging evidence of early success in flattening the curve, though it is far too early to declare victory. However, the success of many of these measures is dependent on the understanding and cooperation of each individual in Uganda. We need all of you to do your part by staying home, regularly washing your hands, keeping a physical distance of 2 meters at least, and when you must be away from home, protecting yourselves, wearing cloth masks if appropriate, and staying home if ill. We are counting on each of you to do your part and encourage others to do theirs. We're in this together. We acknowledge that cooperating with these measures is not easy for anyone and harder for some than for others due to economic and other constraints. We also acknowledge that the fast pace in which things are changing can be confusing, and rumors and misinformation circulate on social media and elsewhere. That is why we are here today. We want all of you to have an opportunity to ask questions and get answers directly from the Ministry of Health and from the U.S. mission. With such a large audience, we will not be able to answer every question, but we will do our best to answer a wide variety of relevant questions with the most accurate and up-to-date information available at this time. With that being said, again, thank you, and I'll turn it over to the Honorable Dr. Jane Ruth Aceng, and then we can get started.
It's a pleasure for me to be here as well, to speak to all of you. Uganda and the US have been in partnership for over 25 years. And one of the strengths we have had as a country, which many countries may not have had the opportunity, is that we've had several outbreaks. And with each outbreak, and with support from the US government, we have been able to build our capacity. At the time that COVID-19 was declared by China on the 31st of December 2019, Uganda was responding to a threat of Ebola from the DRC. And so the declaration of COVID-19 got Uganda ready and in a position to respond. I must say it has been a very trying 3 months, but also a 3 months of learning many new things, because this virus is new and we all learn every day. Uganda moved from a strategy of blocking importation into the country to suppression of transmission, which is currently our strategy. We want to appreciate His Excellency the President for the 33 guidelines on prevention of spread of COVID-19 that he has since spelled out to the country. And I want to appreciate the entire community for responding very positively to the guidelines and also adhering to them. Never have we seen a community so united together to respond to the COVID pandemic, with clear information and supporting the entire health system. We want to recognize that Uganda has good laboratories, as Lisa has said, able to give us results within the time period that is required. We also want to appreciate that the public health training program has empowered Uganda with a good number of epidemiologists, not only to respond at the national level, but also to support the districts. Combined together with the system that we have had in place of each district having surveillance officers and each district having a hub, which is a laboratory that supports the district structure, and the sample transport network that was built on the HIV PEPFAR supported transport network, has enabled our turnaround time to be very short, but also to support the districts in a short period of time. It is a time when everybody must come together and everybody has an input in this response. While we are cognizant that the days ahead may be difficult, we have developed a strategy that we will employ at this point in time during this lockdown. It has been clearly said out by the WHO Director General that lockdowns are only useful if we have strategies to implement during the period of lockdown. So it's not only about extreme social distancing, it is about having a strategy in place to weed out potential sources of the virus. The Ministry of Health and partners have developed a 6 strategic plan to weed out the virus from the communities. And under each strategy, we intend to ensure that the communities participate actively. And I will quickly list the strategies. The first one is to deal with the contacts that are out there in the communities. First of all, we have to take note that Uganda was able to identify 9 of the confirmed cases from the airport. With institutional quarantine, which was one of our strategies to prevent importation, we have managed to identify 31 cases from the quarantine centers. 13 of the cases, to make a total of 53, are from the communities. And so we have to focus on the communities where these people came from. And under the strategy, we will be looking at identifying the contacts and even employing geographical quarantine where necessary. The second strategy is to address the travelers who returned by referring back to the passenger manifest. And looking at the incubation period of COVID-19, we worked backwards 14 days from the time of closure of the airport. That takes us back to the 7th of March. The passenger manifest gives us a total of 18,860 people that we need to reach out to. Reaching out to them means we take a sample, and if they are negative, then we are sure they are not asymptomatic carriers. If they are positive, then we need to move them into isolation, but also follow up the families and weed out any extra asymptomatic cases that may be in the communities. The third strategy is to empower the districts, because all these cases, the contacts of the 13 that are now over 960, as well as the contacts of the people who will be traced from the passenger manifest, will present a large number of people that cannot be managed at the center. This requires that the districts are empowered so that they are able to identify cases, manage them, as well as quarantine them where necessary. This calls for financial support, it calls for technical support, it calls for scientific support. So that is one of the strategies, again, to empower the districts to be able to handle cases on their own. Now, decentralization can prove to be very challenging. But when decentralization is under an incident management system, we imagine that we will be able to handle. The other strategy is about risk communication to empower everybody in Uganda, all those in the villages, to understand what COVID-19 is, what impact it can have on the health system and also on their health, to make them realize that this pandemic of COVID-19 is about life and death, and that everybody needs to participate to ensure that we keep alive. So that there will be a lot of risk communication rolled down to the districts as well as down to each household using the village health teams. And the village health teams will also form a point of contact for surveillance at the household level for identification, notification, and encouraging the surveillance officers to come and remove samples from households that are detected. The other strategy will regard the cargo. Because the borders are closed, cargo is still moving from one country to the other within the East African countries, and this was agreed at an interministerial meeting held between the ministers of health of the East African region. We all agreed that trade should not be stopped, because even with the lockdown, people should continue eating. And so majority of the cargo are carrying goods that are essential for the day-to-day livelihood of the people. But we are also cognizant that cargo drivers are not entirely safe. And so under our strategy, we will be removing samples from the cargo drivers as they come in together with their crew, and want to have a system that ensures that they receive their results within 24 hours so that we don't cause overcrowding of the cargo in the same place. And then lastly, the last strategy is about testing all those currently under quarantine in Uganda. We managed to quarantine over 1,040 people from the 17th of March under institutional quarantine to the 22nd of March when the airport was closed. We have been discharging people from quarantine, and the discharge has followed a scientific basis where if you are in a quarantine facility where nobody has tested positive or developed signs and symptoms, after testing negative, the entire team is discharged. However, for those that are in institutional quarantine where we have had positive cases, it is not possible to discharge them at this point in time. We repeat the tests within 7 to 10 days to see the situation. We are cognizant that of the 53 people that we have tested so far and confirmed positive, nearly 50% have been asymptomatic. And so we want to be very sure that we are not discharging asymptomatic people into the communities. Even those who are discharged into the communities, we still require them to undergo a 14-day self-isolation. Thank you very much for listening to us, and we are ready to respond to your questions.
Great. Thank you, Honorable. Perhaps I will read the first question, and you may wish to answer. So from our viewers, how many districts have COVID-19 testing centers?
Now, in Uganda, we only have one testing center currently, and that is at the Uganda Virus Research Institute. Uganda Virus Research Institute has a capacity to expand the testing, is able to run 75 tests within 4 hours, and it can run over 500 tests in a day or more if we so desire. But as the tests keep coming in, the rapid test kits that are being manufactured globally, as well as the antibody tests, once we have validated them and we are sure about them, we will be able to roll them down to the districts so that we reduce on the turnaround time. But even with the system that we have in place, we are still able to have the results returned within the same day. All that said and done, because of the many tests that we are looking at within the next 7 to 14 days, we are also considering the possibility of having the same tests done at UVRI moved to some other places within, like our National Health Laboratory Services, including down at some of the districts using the Gene Expert machines, so that we are able to handle from various parts in the country.
Great. Do you want to ask the next question, or do you want me to
Okay,
take
the
it
next
back?
question is, if we are looking for travelers from March the 7th to the 22nd, is it possible that they have the virus after 1 month? Well, Lisa, you can respond to that. I can also respond after you.
Please, yes.
Okay.
So we do know from many of the countries around the world that have been facing this epidemic that the typical incubation period does not exceed 14 days. So it would be extremely unlikely that a person who traveled a month ago would develop symptoms. Having said that, we do know that with people in institutional quarantine, and as the minister has said, some of them have tested positive. It's possible that some of those passengers, if they did not adhere to very strict quarantine, may have had another exposure while they were in the quarantine period.
Thank you. And in addition to that, looking at travelers from the 7th to the 22nd is informed by the pattern of the confirmed cases that we are seeing. One of the people who turned positive came into the country on the 13th and only tested positive after 14 days. So we don't want to take chances. It is possible that they are asymptomatic, but they're already discharging the virus and we are not aware. And so having them screened or having them tracked and screened will give us, comfort of being 100% sure that we are not having travelers who are mixing with the population and continue to shed the virus while they are asymptomatic.
Right. Honorable Minister, I think this question is for you. How can I volunteer during this time? I want to be able to make a positive difference in this world. Let me know how I can get in touch with you and how I can be of positive help.
Well, at this point in time, we need all the help that we can get. And you are welcome to join us to respond in whatever way you can. I know there are people out there with different skills and talent and can offer help in various areas. So I will ask you to get in touch with our Director Clinical Services, Dr. Olaro Charles. And if you can't access Dr. Olaro, just route your request through our PROs, and their numbers are out there, and then they will link you up with us. We need all the volunteers that we can get at this point in time. This pandemic is big, and the response needs all of us to join hands together.
Great.
Okay, now Lisa, that question is for you. Does COVID-19 transmit through air?
So, COVID 19 is transmitted through respiratory droplets, and that is a person who is sick. We do know now that sometimes people may be able to transmit the virus even if they themselves don't feel sick, but most commonly it's someone who is ill with fever, who is coughing, who is sneezing. Who is talking, and that's why the social distancing of staying at least 1 or 2 meters away is important. We also know that the respiratory droplets will land on surfaces. So doorknobs, other surfaces. And that's why it's really important that people who are out and about wash their hands very frequently. So if they get the virus on their hands, they must wash their hands to get rid of it. They must clean the surfaces very regularly. I don't know if you want to add.
Well, Lisa has said it all, and the droplets move through air. So you have to be cognizant that when I sneeze or cough and I have COVID-19, the droplets are definitely moving through air and you need to protect yourself. So practice the preventive measures that are being aired on radios, TVs, the media. Wash your hands regularly and don't come into contact with anyone who has signs and symptoms of flu, cough, and fever. Now, the next question is, I had one doctor on UBC saying soon they will start using chloroquine on those with COVID-19 in the event their conditions get worse. She said it's effective. Where did she get that information and where was it proven? Now, we know from the various countries that have been responding to this outbreak that a lot of research is ongoing on the use of hydroxychloroquine for management of patients with COVID-19. It was initially used in China. It is being used in several countries, including the United States, although there is still a lot of controversy regarding the use of hydroxychloroquine. But we do know from the various research that was done in other countries that it is not a treatment, it is a form of immune modulator. Chloroquine was used before in the African countries for treating malaria because it acts directly on the membrane of the red blood cells and it stabilizes the red blood cells so that uptake of oxygen by the hemoglobin of the red blood cells is promoted. And we know that the virus attacks the lungs through the alveoli, through, what do I call them so that you understand? Receptors. Through receptors, which we call the ACE receptors, or the, I will leave it at ACE receptors. I don't want to make it too scientific. Through receptors, and then it gets into the cells. And when it gets to the blood cells, it impairs uptake of oxygen, and the patients end up with respiratory difficulty. And so using chloroquine to stabilize the red blood cells will facilitate uptake of oxygen so that the patients do not go into the severe form. It is still undergoing a lot of research, but where it has been proven, we encourage its use. And even here in Uganda, with the patients that we have under isolation, we are giving them hydroxychloroquine. Thank you.
And perhaps before we go to the next question, I think just to say, as the Honorable Minister has said, this is a very dynamic epidemic. It's a new virus. We're learning every day. The data that we have are mixed, but we are continuing to get more evidence. And I think you've heard from her the scientific rationale for why one might wish to use that drug to treat patients, particularly sick patients. So the next question, is the ministry considering that the virus may have circulated in the population since December and that we are seeing the tail end of the curve? Are there antibody tests in development to begin testing those who may have contracted it far earlier than the COVID testing began? Would you like me to take a stab at that?
Yes, you can.
Okay. So indeed, we know that worldwide, many countries have been facing shortages of testing kits. And in fact, we didn't know about this virus until late December and then early January when the virus itself was first identified. I think we're actually fortunate here in Uganda that, as the Honorable Minister has said, currently we have the capacity to do the testing that's needed, and we are working on expanding that capacity. If I had to guess, I think that it's very unlikely that there was any widespread circulation of this virus in Uganda in December. I think the question about antibody tests is a very good one. And in fact, they have been developed. And I do believe that Uganda and many countries will begin using them soon. I think using different kinds of tests, such as antibody tests, to really understand the evolution of this virus in the population, who gets sick and recovers, who may have been infected but never became sick, what proportion of the population was exposed and infected to this virus, is going to be very important going forward.
Well, just to add a little bit, that the scientists in Uganda are also developing antibody tests. And we do hope that within the next 2 weeks, we will be able to begin using antibody tests made in Uganda. So the next question is, how should people who traveled from March the 7th to the 22nd contact Ministry of Health? Who is the Ministry of Health helpline for people who need emergency medical care? Now, there are two ways to contact the Ministry of Health. If you are staying in the districts, you are free to contact the districts through either the district health officer, the district surveillance focal person, or the district laboratory focal person. We have been circulating their telephone numbers on our website, social media, and also within the districts. If that does not help you, the Ministry of Health has toll-free lines that we have been releasing to the general population. It is present on our website, on our social media and Twitter handles, but you can also access it directly by calling anybody in the Ministry of Health. You will be given the help that you need through the toll-free lines. However, we request that if you have developed signs and symptoms, please do not come to the health facilities. Call the toll-free lines or the district lines, and the health workers will be able to reach out to you and to help you accordingly. Now, Lisa, the next question is, I am a Congolese refugee from Rwamwanja Refugee Settlement and initiator of Refugee Innovation Center. What are measures taken by the government to quit the spreading in refugee settings? You know, refugees are also most vulnerable group of the COVID-19.
Well, I will start, and the Honorable
Yes.
may wish to comment, but indeed, I think the very same measures that we would recommend for everybody in Uganda would also apply to refugees. So that is, if you're sick, stay home from work, or also we're all obviously staying home at the moment, that you keep your social distance as much as possible, that you only go out for essential things, such as procuring food. That you wash your hands very frequently, particularly after you have been out and about, and you maintain social distance. As far as I'm aware, there have not been reported cases in refugee settlements to date in Uganda. But as with the country as a whole, we're certainly concerned about the spread of COVID-19. I think the questioner quite rightly points out that this is a vulnerable group, that may have economic challenges, that may have other social challenges. And so I think that that is something that it's important for us to look into, Honorable.
Okay, just in addition to that, we know that the refugee settlements are within the districts, and therefore the district structures are well positioned to take care of the refugees. If there is any person with signs and symptoms, please do call the district health teams, the DHO, the district surveillance focal person, or the district laboratory focal person. They will definitely visit the refugee camps and give you the support that you require. Next
Yes.
question.
So the next question: can someone get cured from COVID-19 just by eating fruits and vitamin C?
Go ahead.
Sure. No, unfortunately, as a new virus, as we heard from Honorable Minister Aceng, there are drugs that are under investigation, such as chloroquine, but we do not have a cure at this time. We do, and I think many people around the world, particularly researchers, including here in Uganda, are busy working on therapeutic agents to treat COVID-19 as well as vaccines to prevent COVID-19. But at the moment, there is no cure. I will say that maintaining a healthy lifestyle, so eating a healthy diet that includes fruits and vitamin C, getting enough rest, drinking plenty of fluids, will certainly protect your immune system. And if you do become infected with COVID-19, might help in your recovery. Next question is, what is the Ministry of Health's position on lifting the lockdown?
Well, first of all, to take note that the lockdown is government's position, not the Ministry of Health alone, because our response to the COVID pandemic is multisectoral. And every ministry, department, and agency has a part to play in this response. Now, the lockdown gave us opportunity for extreme social distancing. And within the lockdown period, as I clearly stated in my opening statement, we have activities that we intend to implement that can be best done when we are under the lockdown period. If we do very well during the time of the lockdown and we accomplish all the activities that we have set out to do, and we are sure that we don't have any community transmission, I believe the government will lift the lockdown. However, not all the 33 directives may be lifted, especially as regards the border points as well as the airport. But again, all this depends on what happens during this time. If we don't see a rise in the number of cases and we are sure that we have managed to flatten the curve, that will be a good indicator for lifting the lockdown. But we have to be cognizant that Uganda has many neighbors, and our borders are not watertight. We have to be sure of what is happening in the neighboring countries and not relax a little bit on our response. So, in summary, what I can say is that lifting the lockdown will depend on the trends or the evolution of the pandemic in the country and the results that we are sharing with you on a daily basis. Now, the next question is, how are the people that came from the neighboring countries like Kenya and others being identified? Because those were still coming in even after the airport was closed. Should I go ahead?
Sure.
Okay, good. Now, just like I have been saying, we don't have watertight borders, and the borders just separated relatives from each other. So we still have people coming in not only from Kenya, but from the DRC, from Rwanda, from South Sudan, through non-designated points of entry, which are quite many. Others come in for purposes of looking for food, others come in to see their relatives, and others come in to seek medical services. Now, it is only easy for the communities around those border points to identify these people. And that is why one of our strategies is to intensify risk communication so that the communities around those points of entry can become each other's keeper and will be able to notify the district authorities accordingly about anybody who is non-Ugandan coming into the country. Our plan is that if they are coming in to stay, we get them identified and tested. If they are coming in for medical services and they are going back, well, they will get their medical services since they have already beat the security check and come in. We cannot deny them the services. They will receive the services. But we want to discourage movements at the border points. All the countries within the East African community have closed their borders. And so we expect that the people from each country will adhere to the different policies that have been put in place by their governments and not cross over at any time as they feel like. We also want to expect that the security agencies at the border points will do their best to ensure that we don't have illegal crossovers by the different populations. So the next question is, kindly provide us with clarity on the alleged antiretroviral drugs that is assumed to cure COVID-19. Lisa?
Yes, certainly. I think that's a very important and relevant question. As we have been talking about right now, there is no cure for COVID 19, although researchers are busy looking at what is on the shelf that is an antiviral agent or a drug that treats viruses that might work. So I am aware that quite a number of studies have looked at antiretroviral medications for HIV, such as lopinavir, ritonavir, and others. But to date, unfortunately, they have not shown efficacy. And I think that researchers are going to continue to look at existing drugs that are out there and whether they might be able to treat this virus. But at the present time, I think it's important for people to understand there is no evidence that antiretroviral drugs for HIV have any effect for COVID COVID-19. So we need to make sure that people living with HIV who are taking HIV treatment with antiretrovirals continue to do so, and there isn't any evidence that using those drugs for COVID-19 has any effect.
Okay, so we don't understand the next question.
What is the role of the white lady? Is that me, perhaps? Okay, I can answer that. So I think, as I said a bit at the outset, on behalf of the US government, there are many agencies that work here in Uganda and have worked in Uganda for many years supporting public health. The Centers for Disease Control and Prevention, or CDC, is one of the technical partners of the government of Uganda and of the Ministry of Health in particular. So I think we're here to support the government of Uganda's response and to support the Ministry of Health.
Good. And as I mentioned before, Uganda and the US government, through the Center of Disease Control, have had a partnership for over 25 years. We have been responding to several outbreaks from the time we had Ebola in the year 2000 to date. We have gone through many outbreaks together. And so the white lady sitting next to me, who is the director of CDC Uganda, is supporting me in this response. So the next question is, when will the health workers get risk allowance and personal protective equipment? Now, risk allowance is given to those that are in the front line responding to the pandemic. And health workers have been getting risk allowance from the time that the outbreak was declared in China, first for those who were at the airport screening and those at the border points of entry. And now we have several health workers handling the various parts of the outbreak, and they continue to get their risk allowance on a regular basis, including those that are treating patients in the isolation facilities. The personal protective equipment are provided to those at the front line, and they have it. That is why they are managing to follow up people in the quarantine facilities, remove samples, and also respond to the various alerts that we have coming in every day. Over 6,000 alerts do come in, but we also have samples that are removed through the district hub systems because of the availability of personal protective equipment. We are cognizant that other health workers, not necessarily responding to the COVID outbreak, but providing the basic health services to the rest of the population, also do need personal protective equipment, or in this case, at least a mask and a face shield. So government is working on this, and we shall be able to provide it as soon as we have procured it. The next question is, what is the status of patient 1? Should I answer?
Sure.
Oh, good. Okay, patient 1 was admitted on the 21st of March and has been in isolation since that time in Entebbe Grade B Hospital. So we have had opportunity to manage patient 1, and he has been stable. Right now he has no fever. He only came in with a fever. He was not coughing and he did not have flu. And right now he has no fever and he does not have all the other symptoms. We managed to rescreen patient 1 on day 14 and he still had a viral load. So we are screening patient 1 again at the end of this week. And should he have a negative test, we will repeat it again after 24 hours. If he remains negative, we will consider discharging patient 1. The procedure is repeated for all the other patients who are receiving treatment in the isolation facilities. The next question is, how do we access emergency services during this time? How do we get emergency medical attention when we reside far from town? You
Well,
want to respond?
well, I think it's more of a question for you, and I'll
Okay.
chime in if I have anything to add.
Okay, so emergency medical services outside the COVID response can be accessed from all the facilities within the country. We have ensured that no medical facility closes, whether it is public, private, or private not for profit. So the services continue. But we are cognizant that the means of transport to access the services may be the challenge that the population are currently facing. So the system works in such a way that if you have your own private means of transport, then you can reach out to the resident district commissioners or through his system down to the mayors in the different locations. They will be able to give you a travel pass to enable you drive your own vehicle and access emergency medical services. If you do not have your own means of transport, KCCA has positioned vehicles, buses, and other smaller vehicles in 29 locations all over the city or the greater Kampala metropolitan area. You are free to walk to any of these points, board any means of transport, and it will take you to the facility of your request. For those out there in the districts have positioned vehicles again in the sub-county areas and other positions where you are free to board and go to any facility to access medical services. Again, I want to repeat here that those vehicles that have been placed in those positions are basically to assist health workers access the medical facilities and the patients to get to the medical facilities. They are not for any other persons who want to go to places of their own desire. Remember, we are under a lockdown period, so our request to you is to stay at home and stay safe.
Great. Maybe I'll take this next question. How long will it take to discover COVID-19 drugs or vaccines? This is an unprecedented new virus. I think one of the really remarkable things about this epidemic is the scientific collaboration that has taken place around the globe. So within days of understanding there was an outbreak in Wuhan, China, the Chinese released the sequence of the virus, and researchers around the world began working to develop diagnostic tests, to test new therapeutic agents, and to begin working on a vaccine. That's the good news. And I think that that scientific collaboration is continuing, and we're hopeful it will lead to new developments. Having said that, to develop a new vaccine for a new virus takes time. Many different candidate vaccines are in development, probably several dozen, but they're in early stages, phase 1 and moving into phase 2 trials. To ensure that we know the safety of the vaccine as well as the efficacy, whether it works, I think most experts estimate that that may take at least 18 months for us to have a vaccine that could be used in this epidemic. It's possible, as I mentioned earlier, many different drugs are being tried on patients who are ill. And if there are drugs already out there that have been developed for other diseases, we may find a drug or a therapeutic agent sooner than a vaccine. But we are hopeful, and I think the fact that there has been such tremendous scientific collaboration around the globe, that results are being shared in real time, gives us hope that as soon as we have a vaccine, that we will find ways to make it available.
Okay, so the next question is there an update on the border man in Kisubi? Yes, the border man in Kisubi is in the isolation facility at Entebbe, and he's doing well. We also managed to trace his contacts, and we are still having a conversation with him to understand how he got the COVID-19. We have heard stories that he was ferrying people from quarantine. He is yet to verify those stories and give us more information for us to follow up. But I must say he has been very cooperative, and he has enabled us to pick the contacts. Lisa?
So I'll start, and the minister may wish to chime in. The next question is, why don't you extend testing centers? And I think we're fortunate in Uganda, and that is through many years of investment in the laboratory sector, that we have a system that works very well for centralized testing at Uganda Virus Research Institute, or UVRI. And that's based on 100 hubs around the country where specimens can be collected, transported, and results returned. And on average, it's well under 24 hours for test results to for tests to be done and results to be returned. I think, as the minister talked about, as more tests come online, rapid diagnostic tests, potentially antibody tests in the near future, and the availability of other testing platforms such as expert machines, which are widely available in Uganda for testing for tuberculosis. I do think that it's quite likely that testing will be further decentralized. The minister also talked about potentially testing at at points of entry. I think the challenge that has been the case in Uganda, but also in many other countries around the world, is the availability of the tests, which we now are having sufficient tests in Uganda, and then making sure that those patients who are the sickest and most likely to have COVID-19 are able to get a test. But I think we have, as I talked about with other research activities, there has been a very rapid expansion, both in different types of tests that can be done and potentially decentralization in the coming weeks. Minister, if you want to add. Okay. The next question, what is the condition of those in quarantine? Is there a sign of recovery, and how are you managing the victims since there's no medicine for them?
Well, those in quarantine are not necessarily sick people. We are keeping them in quarantine because they have a history of travel, and two, because they may be potential people who may be asymptomatic and shedding the virus. And so as the 14 days countdown in quarantine come to an end, we have been taking samples from them and screening them. Those that we continue to keep in quarantine are those who have had contact either in quarantine or they have had people that they came with testing positive. So we'll continue to follow them up. We don't necessarily give them medicine. They are there for purposes of follow-up and testing. If they test negative and there is no history of contact with any other person, we discharge them from quarantine. Now, the last question is, it appears that some people who are declared COVID-19 free after infection get reinfected, as seen from China. Is there any projected long-term side effects after being infected by COVID-19? Should the world be worried about any potential clinical or epidemiological effects, especially for those who recovered from COVID-19? Lisa?
Yes, well, as we had said at the outset, this is a new virus and we're learning all the time. I think some of the things we've been learning recently are that people can have asymptomatic infection and pass it on to other people. So the good news is, in a way, many people may actually have very few side effects if infected. The bad news from that is people who have few side effects or no side effects are at risk of transmitting that virus to other people, potentially unknowingly. In terms of the question about long-term side effects, I'll be honest, it's probably too early to say. We do know from our experience with a very different virus in West Africa, Ebola, that people were able to harbor the virus for much longer than we had originally thought, and that there probably were symptoms and other sequelae from the infection that did occur later. But since this virus was only notified on December 31st, I think we're still learning about what the potential long-term effects of this virus might be. what the risk of potential reinfection might be. And I think we'll all have to pay attention to the emerging scientific literature as it develops.
Thank you so much, Dr. Nelson and the Honorable Minister, Dr. Aceng. Thank you so much for all that information. Thank you to all the viewers. We had an incredible amount of questions come in, and we weren't able to get to all of them. But that's what this was all about, a chance to get to as many of your questions as we could. We are going to continue to try to answer them. So we will do our best to answer them in the chat box. If you have additional questions, feel free to continue to type them in onto the Facebook page, and we will do our best to answer them. Please also share this with others. This video will now stay up on the Embassy's Facebook page, on the Ministry of Health's Facebook page also. Feel free to share it with others. We want to spread the information as widely as possible. Continue to follow the Ministry of Health on Facebook and Twitter for the latest information. Also the Embassy, the U.S. Embassy at U.S. Embassy Kampala on Facebook, U.S. Mission Uganda on Twitter for the latest information. We are very much in this together. Stay safe, stay home, wash your hands, and keep in touch. Thank you so much, everyone.
Good. Thank you. Thank you.